All right, well, good morning. I want to welcome you here today to a wonderful occasion where the NuHealth system, which runs the Nassau University Medical Center, a Holly Patterson Extended Care Facility, and four family health centers, as well as a school-based clinic in Roosevelt, is able to announce for the first time since it was created in 1999 that it operated in the black during the 2009 fiscal year. Now, we operated with a very small surplus, about $800,000, on a budget of about $540 million. So it's not that much, but even just breaking a little bit into the black is very, very significant for an organization like this. It shows that the work that's been done by the financial team, the operational team, and the clinical team over the last decade has really borne fruit in the results that we saw last year, and it really sets us up to deal with significant challenges going forward. We're not in any way out of the woods. We have a lot of work we got to do. The reality is this year and going forward, we have significant pension contribution costs that we have to grapple with. We have declining federal and state reimbursement that we have to grapple with. We have the economy that we have to grapple with, and we have the changes that are going to be induced by health reform that we have to grapple with. But this corporation, the NuHealth system, has risen to the challenges before. We've succeeded this year, and my expectation is that we will be able to rise to the challenges in the future. But those challenges get harder and harder each and every year. I want to thank all of the members of the NuHealth system, but really in particular, Gary B., our Executive Vice President for Finance and our Chief Financial Officer, for really exceptional financial stewardship of a very, very challenging and a very, very complex organization. Without his financial stewardship and his smarts, and as a friend of mine says, his street fighter attitude as it relates to the finances of this company, we would not have been in the position we were in 2009, and we would not be in the game going forward in 2010 and beyond. He and his team really are a credit to how you do financial management the right way in very challenging situation. Couple final points, and I want to turn it over to Gary to say a few words. First, the reason why we're talking about this, even in the context of the state budget coming out, where we saw a reduction in our reimbursement and the other challenges that we see, is that it's important for people to realize that the things that have been done over the last 10 years have worked and got us to the point that we're at. All right, that's number one. Number two, it's important for people to realize that even if we have challenges in the future and maybe we don't break into the black in subsequent years, that we did break into the black this year, number one, and number two, that it's important to understand that this management team was able to succeed in doing it, and it's no small feat. And I think last point is that result, I believe, vindicates the strategic approach that management has taken over the last several years to the stewardship of this organization. Whether you're talking about the financial stewardship, operational changes, the modernization program that we've implemented, the real estate development program that we've implemented, or our integration efforts and regionalization efforts with the North Shore LIJ health system, all of these efforts strategically have contributed to improved quality and to a better bottom line. That vindication, I think, is important. So with that, let me turn the microphone, such as it is, over to Gary B. to say a few words. And again, I want to congratulate the NuHealth system. I want to congratulate the team. And I want to congratulate the finance department in particular frankly, for a job well done. Thank you.